health arm of what Ron and his team do. HomesteadFamilyWealth.com is for the wealth, the financial arm of what they do. The number is the same, though, 830-243-6377. Once again, it's 830-243-6377. My name is Chris Swan, and I'm pleased to be joined, as always, by Mr. Ron Ray. Ron, glad to be with you again. How are you doing, sir?
Good morning, Chris. I'm doing great. We are having just a great winter here in New Braunfels, Texas. Been uh, damp. We haven't had a whole lot of rain, but had some nice cool weather and some nice events going on. And we're looking forward to another great weekend this weekend.
Absolutely. And it's one of those things where, taking the cooler weather right now and enjoying that because we know what the summer is going to bring, however long that summer is going to be, going all the way to November or what have you. And it's a great parallel when it comes to, yeah, exactly. It's a great parallel when it comes to retirement. It's not always going to be, 70 and sunny. There's going to be rainy days. There's going to be extremely hot days. There's going to be snowy days. You want to have a plan in place that's going to get you to, through, and beyond. And that's what we're here to help talk about, making sure that you don't have to do what so many retirees and pre-retirees fear, and that is having to unretire out of necessity. And let's start by talking about this because Social Security is going to be a component with so many people's retirement accounts. And the earliest age people can claim is at 62. And while taking advantage of this stream of lifetime guaranteed income as soon as possible may sound promising to people, I've paid into it, let me get it as soon as I can. Here's the truth. Your monthly benefit check is going to be about 30% less than if you waited to claim it at your full retirement age, which right now for most people is 67. So what are some of the key factors that you weigh in, you and the team at Homestead Family Wealth weigh in when helping clients make this decision about when to turn on this stream of income?
Well, Chris, we definitely weigh in. This is one of my favorite topics to talk about with clients because it gets me excited because there's more planning that goes into it than just saying, "Oh yeah, wait until you're 70 because you'll get more money." I mean,
Right.
that's an easy answer, and I think that's where most advisors go because, frankly, they just don't want to put in the work to doing the analysis and asking the questions that really matter. And a couple of questions are, how's your health? How long do you expect to live? Because
Mhm.
if you're like my dad, for instance, he took his at 62, and he knew he was going to take a hit, a 30 to 40% hit over his uh, expectancy to get to full retirement age. But he was in bad health, and he didn't expect to live long enough to break even. So if you waited from, let's say you waited from 65 to 70, well,
Mhm.
you're going to make more money. Your Social Security grows at 8% per year for every year that you wait. But that's a
It's
good
not bad.
amount of money that you're leaving on the table while you're waiting. And the break even point is about 12 years. So if you take your
Okay.
Social Security at 70, you've got to wait, you've got to live to about 82 just to break even on the money you left on the table while you were waiting. And so that's one of the factors. What's your life expectancy? How's your health? How long do you expect to live? Another question is, do you need the money? Can you use it? Can you put that money to better use than Uncle Sam? Right? Even if you were just putting it back in the bank and
Mhm.
earning, 3% on it, in a CD or in a savings account right now. Do you think that you could do better with that money now than letting it grow? So those are two reasons to take it early. Another reason to maybe delay is, are you married? Do you have a spouse that you need to grow a higher income for after you're gone? So remember, when one of the spouses dies, the surviving spouse keeps the higher of the two Social Security checks. One of them goes away.
Mhm.
And, a lot of households are what I would call more traditional households where one spouse worked and was the primary breadwinner, made significantly more money, and therefore has a higher Social Security benefit coming, and the other either didn't work, was a homemaker, or worked at a job and just didn't make as much money as the primary. And it's not a male female thing. I see it go both ways, but
Right.
it is quite common. Again, based on your life expectancy, do you need your spouse to have more money after you're gone? If so, you may want to delay and let that Social Security grow a little bit longer in preparation for your eventual death and passing on that Social Security to your surviving spouse. So I'm not totally one way or the other. I think I do fall more in the camp of take it while you can, because
Mhm.
it may not always be there. And people say, well, Social Security is always going to be there. I think it's probably always going to be there, but is all of it going to be there?
Right.
That's the question. And I used to tease my dad all the time. I'd say, you're welcome. You're spending my Social Security now. You're getting my Social Security that I'm putting in. I'm never going to see that money. And I don't know if I will, but I know
Mhm.
that in about 10 years, unless Congress fixes it, they're going to cut your pay by about 25%. That's already written into the law. Unless
Yeah.
they fix the deficit of more money coming out of Social Security than is going in, they're going to cut your pay by 25%, up to 25%, maybe more if necessary. And let's face it, they haven't fixed it in the last 40 years. So what leads you to believe that they're going to do it now?
Right.
Now, I think we're
Congress
going to talk
historically
about in a minute some things that are going on recently, some controversial things that are going on in the government, and maybe they'll fix it. I don't know. I'm going to plan for them not to.
again, Congress known historically for being very quick to act, but there are hundreds of ways to claim Social Security. And survivorship benefits and things like that to take into consideration. Great time to remind you that the people at the Social Security office, they're not there to give you that advice. They're there to process the paperwork, send you on your way. We know it's not that quick either. Not besmirching them by any means. It is a very important job, but you need to do your legwork ahead of time. Figure out when to turn on Social Security, and it's going to vary from case to case, obviously. So having a team like Homestead Family Wealth help you out with that is as easy as setting up a time to come in and speak with them. Complimentary time, have that conversation, begin that process. HomesteadFamilyWealth.com is the website. The phone number is 830-243-6377. You queued it up, so let's go ahead and talk about this here. President Trump, he has been busy in his first month in office, signing a lot of executive orders. The one I want to talk about in particular, it's kind of humorous to me in a way. He is directing the U.S. Mint to stop production of the penny because it currently costs about 3 cents to produce every penny. It's costing money to make money. It's not worth 1 cent. At the end of the day, it's negative 2 cents. It makes sense to dump it, I think. This could save the government more than $20 million a year. So certainly no small chunk of change there. Pardon the pun. When you do an analysis of a retirement plan, what are some of the easiest ways you find to help save clients money?
Well, I think the one of the easiest ways, Chris, is to find little mistakes like the one
Mhm.
you just made. You said $20 million a year. They're actually estimating it at $200 million a
I
year.
left the zero off. Yep, you're right.
$200 million a year just by eliminating the penny.
Yes.
I don't know, Chris. I can't remember the last time I used a penny. I know that there's a bunch of them sitting on my dresser in my bedroom. We've got jars full of coins, and I know that a couple of years ago we got ambitious with the kids, and we counted coins and we rolled coins, and we took them to our bank. And I won't name our bank in town that did this, but they wouldn't take them. They said, we don't take bulk coins. I said, but they're rolled.
Yeah.
No, we don't take them. We'd have to unroll them and count them. And so what do you do with them? You take them to the coin machine at HEB and pay, the coin machine, 8 cents or 10 cents on the dollar just to get rid of your coins.
Right. Right.
And I guess that's what you do with them. I don't know. And I don't know, maybe that was just our bank, or that teller was having a bad day and didn't want to deal with them, or if that's a thing across the banking industry. But I got to tell you, for $200 million a year, bye.
Yeah.
See ya, pennies. I don't need you.
Yeah. No.
And so, sorry, got on a little bit of a rant there, but that's how we can help people, is just finding waste, finding things like junk fees inside accounts. We talk about that pretty often here on the show. Junk fees. There's several headwinds to retirement: inflation, risk, and fees and taxes are the four main headwinds. Junk fees are the easiest ones to cut out.
Mhm.
If you're paying fees inside your accounts or inside something like a variable annuity, those are the easiest things to cut. All you have to do is find them. You have to have somebody like me or like the team here go through item by item, prospectus by prospectus, because it's not going to be on your statement. Those fees are not on your statement. Your advisor's fee is, but your junk fee is. And so what do you do with them? You take them to the the fee that you pay your advisor to be your personal shopper, to go out and pick those assets that have these junk fees in them, that's okay. I mean, I get paid as an advisor. I certainly want to do that. But there's other fees. A variable annuity can have fees 3 or 4%. And what are you getting out of them? So if you're not getting anything out of the fees that you're paying for, let's get rid of them. Saved you 3% right there.
Not to say that all fees are bad. There's certainly value that has to be assessed. And if you don't know what you're paying, it can be very difficult to assess the value if you don't understand outright. Having a plan in place that addresses these. This is something that you guys do. You shine a light. Obviously, a lot of what the government is doing right now, the DOGE, the Department of Government Efficiency. We want to talk about your personal efficiency. Maybe there are things out there where you're paying more unnecessarily in fees, or you're withdrawing too much from certain accounts, and it's triggering Medicare to cost more. We're going to talk more about Medicare in a little bit here. Taxes is a major factor. Social Security and the implications with that, paying that money back in taxation. Let's make your plan as efficient as possible. Not going to say we're going to save you about $200 million a year. Can't believe I neglected that zero. That is a significant more amount. But any bit more that you're saving is more money you get to keep to utilize for your own retirement plan. So take the first step and reach out to the team at Homestead Family Wealth and set up a time and have that conversation, begin that process. 830-243-6377 is the phone number, or you can go online to the website as well, find out more about Ron and the team at homesteadfamilywealth.com. Here's what we're going to do. We're going to step aside for a second, give you a chance to go ahead and make that call and reach out, set up a time to speak with them. And when we come back, there is more to your health and wealth with Ron Ray. Let Ron and the team at Homestead Family Wealth, let them, for lack of a better term, be your DOGE, your department of government or general efficiency, I guess. Just set up a time to speak with them, 830-243-6377, or online at homesteadfamilywealth.com. Welcome back, and thanks so much for joining us here on To Your Health and Wealth with Ron Ray of Turning 65 Solutions and Homestead Family Wealth. T65solutions.com is the website. Homesteadfamilywealth.com is the website. Again, whether you're trying to reach the whichever arm of what Ron and his team do, those are the websites. The phone number is the same, though. Set up that time, that complimentary consultation, 830-243-6377. Ron, there was a recent study of 240 financial advisors, and it found that more than a third of them, so 80 plus, who had been in the business for 11 years or more, they were less inclined to offer financial planning and wealth management. So to break that down, again, people go to financial advisors for financial plans, and it turns out that 1 in 3 of them don't actually do it. What's the story here?
I don't have a good explanation for that one, Chris. That's nice. You know,
Yeah.
I was always taught if you don't have something nice to say, don't say anything at all. However, this is a talk radio show, and I feel compelled to talk. So
Do it.
I think it's just of a little bit of laziness,
Mhm.
or probably more accurately, or more gently put, a lack of understanding of a financial planning process, or a
Yeah.
retirement planning process, because it's real easy to go out and market, do seminars, or do mailers, or do web advertising, or television advertising. Radio advertising is big for financial advisors. And you spend a bunch of money, and you get somebody in, and you give them a talk, a pitch about what you're going to do for them and how well their money's going to do. And then you get them set up, and you start charging them your fees or your commissions. And then that's about it. And that's kind of the dirty little secret in this industry, is once a client comes on board, once they're onboarded, once they're in and everything's set up, there's not that much more work to do.
Mhm.
And so I think that a lot of advisors get into the business with good intentions. I'm going to go out there, and I'm going to be the best financial advisor that I can, or best financial planner, or best retirement planner that I can. And it just falls off. All of a sudden, it gets real easy just to bring in assets under management and charge their 1 to 2% and collect that annually. And all I really have to do is give a phone call, once or twice a year, just to check in with the client, and maybe send a birthday card. And that's about it. And that's probably about all that most financial advisors do. And that's a shame, because there's a whole lot more to it, especially when you're working with retirement age folks or
Hmm.
pre-retirement age folks, because you've really got to take that holistic approach. And that's what we do here at Turning 65 Solutions and Homestead Family Wealth. It's a holistic approach. We take those 4 pillars of retirement: healthcare, life and legacy, long term care, and retirement income planning, Social Security planning, and we bring those under one roof. And then we bring in the CPA, and then we bring in the estate planning attorney, and everybody's on the same page and everybody's on the same plan. And it takes a lot more work and it takes a lot more expense on our part, but we put out such a superior product when it comes to a plan that is actually going to meet your goals, actually fit your goals, doesn't just fit a cookie cutter over here
Yeah.
that says, okay, well, you scored you scored a moderate on our risk management scale, so we're going to put you into this model portfolio that fits in this cookie cutter for a moderate risk profile. There's so much more to it, because think about this. If you're listening out there today and you have a financial advisor, when was the last time your financial advisor talked to your CPA? When was the last time your financial advisor got you in the same room with your estate planning attorney and went over your will and who's going to be the trustee and who's going to get this money and what do you need this money to do for you exactly? That's what we do. And that's that holistic approach that most advisors are simply just not going to do. And they're not going to do it for 1%.
It's important, especially as you get into retirement and through retirement, to know, you're taking into account all these things, for lack of a better term, knowing what one hand is making sure that both hands know what the other one is doing. In a previous career, a previous walk of life, I worked at a pharmacy. I was on my way through pharmacy school, and there were often times where a patient would come in with a new prescription from their endocrinologist or their specialist, and we put it in, and we go, there's some redundancies here, or this is going to counteract what their general practitioner has recommended for them. And we'd have to call the doctors and get that squared away. And it's because they didn't know. This doctor wasn't talking to this doctor. They weren't in network, and so they're in the same network, and so they couldn't see this. But it's very similar to what you guys do.
Mm-hmm.
The tax implications could affect your Social Security. The income implications could affect your Medicare costs, and so you want to make sure that it is all working together in lockstep, because if one of them goes awry, it could make the whole thing crumble, and that's not what anybody wants. No one wants a plan to fall apart, especially in retirement. And so it is important, I think, to have that holistic approach, to have someone who is actually, not just sending you. I got a magnet from the guy that we financed our house through. I get it every football season. It talks about all the games that are coming up, the home and away schedules, and I love it. But I mean, we don't actually talk. I don't talk to that guy. Uh, we've had that house for 10 years now.
Yeah.
But again, you want to make sure you're in conversation a bit more frequently. So if your current financial professional has not been in communication with you and is not talking to you about the taxes or the healthcare or the myriad of things we've talked about here, why not reach out to the team at Homestead Family Wealth and Turning 65 Solutions and begin just that conversation and see what can be done and what should be done. Reach out 830-243-6377 or going online to the websites t65solutions.com, homesteadfamilywealth.com. Ron, this past weekend, I met up with a friend that I hadn't seen since high school. It had been quite a while. I've known them well over half my life, and we had a conversation, and it is taboo to bring up people's weight, and I understand that, but they lost a lot of weight significantly. And first, I made sure it wasn't a health situation. You try that carefully, and I went, I got to tell you, you look great. What's going on? It's a health regimen. Like what are you doing? And they got a little sheepish, and they confessed to me. They went, I'm under the needle. And I was like, oh, okay. Ozempic, one of those things that is very popular these days. You see these commercials, people are talking about it, celebrities, friends, relatives, loved ones. There are people out there that are Medicare age who may be curious about it. And so let's talk about that. Let's spend a little time here. Ozempic and Medicare, is this something that can be covered, that is covered, or what do people need to know?
It can be covered, and it is covered for diabetes and for any use that it is currently FDA approved for.
Right.
It's not covered, however, for weight loss alone.
Okay.
And now that is causing us a little bit of an issue this year because we had people last year, even though it technically was not covered, some of the insurance companies were covering it. I don't know if
Mhm.
they just slipped through the cracks or were flying under the radar. This year, after the changes and the costs associated with the Inflation Reduction Act to the insurance companies, they're saying no. If you don't have diabetes, you don't fit these criteria, these FDA approved criteria, which may be something like you have heart disease that is exacerbated by obesity. Maybe they'll approve
Mhm.
it for that. But if it's really strictly just for weight loss and you don't fit these other comorbidities as we call them, your insurance company is probably not going to cover it, even though they may have been covering it last year. This year they're not, and so that's been a big issue for us here just in the first 6 weeks of the year because every indication was when we were doing our prescription reviews in the fall, every indication was that everything was going to continue as usual. And then get
Right.
to January 1st, more like January 3rd, 4th, 10th, when people started going to pick up their prescriptions and
Mhm.
they go, oh, this is $1,000. Well, guess who gets
Big
a
shock.
phone call? We do. And so it's been an issue. We've got some ways that we can get these prescriptions covered, namely the brand names like Ozempic and Wegovia and Manjaro uh, covered, maybe not through your insurance company, but through other sources like a manufacturer's program or a
Mm.
grant funded program. And there's ways to get it done. And we're doing that. It takes a bit of extra work and we're happy to do it. Just, give us a call if you've had a problem with this and we'll see what we can do. We can't make any promises. We certainly are not giving any kind of medical advice, but if this is something that you have been on and you've gone from paying $50 a month to 1,000, give us a call and we may be able to find another way to get that for you. And it's been a disappointing thing because it has been a really good thing for a lot of people,
Mhm.
and to see somebody who's been on a road to improving their health all of a sudden are forced off of that road because they can no longer afford it is a troubling issue. And you would think that obesity being such a problem and
Yes.
a problem that leads to so many other health conditions, costly health conditions, that the government would say and the insurance companies would say, well, yeah, let's pay for it because it's going to save us a lot of money down the road. Now, I don't know how that math works out. I'm not an actuary at a health insurance company, but it sure makes sense to me. But we're doing everything that we can to help people find those programs, apply for them, track them. We work with your doctor to get the right papers signed, whether it's a formulary exception with your insurance company or just simply finding you a different pharmacy that may
Mhm.
have a different way of doing it for you. That's what we're doing. So just give us a call and we'll see what we can do.
We talked about those inefficiencies, like the penny costing more to make than to actually keep, and those inefficiencies and quite frankly, unoptimal situations in people's retirement plans. This could be one of them. Going from $50 a month to paying that is a significant markup. And so, if you have questions, if you got that sticker shock earlier this year, and you want to see, if there is a way to continue on this medication without paying a mortgage price for your medication, reach out to the team at Ron and the team at Turning 65 Solutions. They can certainly help. Again, can't promise anything, but they'll take a look at the situation and find out if there is a way to reduce that cost, if not outright eliminate it. But all you have to do to reach out is set up that time to come in and have that conversation. 830-243-6377. Once again, 830-243-6377, or the websites, t65solutions.com. That is the health arm of what Ron and the team do, and that is what we're talking about right now. But of course, the finance, because they work together in conjunction, and it is that holistic approach. That is homesteadfamilywealth.com. Either way, they hope you reach out. They look forward to speaking with you and helping you get to, through, and beyond retirement. And as always, we want to thank you for joining us here on To Your Health and Wealth with Ron Ray. Stay safe out there. I hope you have a great week ahead of you, Ron. Always grateful for the time and look forward to having another conversation next week.
Yep. Thank you, Chris.